Many thanks, Prof. Ong. So it's a real pleasure to be invited to share some of my thoughts who may be thinking about applying to NUS to take on non-STEM related research panel. But I actually would like to highlight that when we start to look at policy issues, and earlier on, I had the pleasure of listening to Professor Cashaw's talk as well, the non-STEM issue, the social science, the behavioral science are actually very vital elements. And I could actually spend the next 20 minutes talking about how social science and behavioral science has been fundamental in the fight against COVID-19. But instead, I think what I would try and do is to talk about some of the research that students in my school, the School of Public Health, have been working on that straddles this domain of social science, behavioral science, understanding behavior, understanding economics. And I've titled my talk as really thinking about improving the health of entire populations, because that's fundamentally what public health is about. And I thought it's often useful to start off with what my perception of public health is, because even though I'm the dean for the public health school, I must admit that I had zero public health training before they made me the dean. So I'm still thinking that at some point in time, they will realize that they made a really bad mistake appointing me as the dean. But this is my interpretation of what public health is. And there are very critical elements around prevention. How do we protect the health of people, preventing them from getting ill in the first place? And this is where you can think about diabetes, COVID-19, malaria. That falls into the space of public health prevention activities. There's also screening. How do we identify people who are at risk of certain conditions? And again, the few diseases that I talk about, screening becomes a very important element, because often in medical conditions, the earlier you find people, the more successful you are at finding people, the better the outcomes will be for these people. And that's where you would realize that understanding the mentality, the mindset of people, reaching out to the vulnerable segments of the society becomes a very important strategy when we want to improve our screening outcomes. And finally, of course, there's how do we control medical problems to minimize complications? And that's actually the activities that we have in public health. But in addition to that, it is not just about these activities. We also need to understand that you may have a particular medical device, a particular approach of reaching out to people for screening. But the question is it cost effective? I can come along with a COVID-19 therapeutics, but in order to treat that one person, it may cost $1 million. Clearly, that would not be cost effective from a national perspective, but from an individual's perspective, it is effective because the person's health will improve. So that's where public health comes in, to really understand what is that balance between the good of the entire community versus the health of a single individual. Then there is also elements about how we communicate. So you may have seen in newspapers, in media reports, many people working in public health, whether they are clinicians or whether they are practitioners, they are currently communicating what are the best practices to minimize the risk of being infected with COVID-19. So policy, communication, education, pushing for the right policy, this is also a very important aspect of public health. And finally, how do we ensure that the way that we finance our health system, the way that we pay our doctors, the way that we use our MediSafe, MediShield health insurance in Singapore is a sustainable approach, and yet it's also a fair and equitable approach. And I hope with my very quick introduction of public health, you now have a sense that actually public health isn't just mainly around the mathematics, the statistics, the infectious diseases, the medical sciences, but equally, there is a very important aspect, focus on the social sciences, on the economics, on the behavioral sciences, and also on the implementation sciences. All of this, which we broadly classify under non-STEM. Now, many of you who have been in Singapore for at least the past 2 to 3 years will be familiar with the war against diabetes that Singapore waged, because we saw that this is going to be a real challenge to the health of the community, and it's going to cost the government a lot of money. So we actually became the first country in the world to wage a war against a chronic condition such as diabetes. But this is actually something that was advocated and pushed for from the NUS School of Public Health. And the next few slides, I will take you through the journey that we undertook in pushing for this nationwide campaign against a chronic disease. Because when we declared this war against diabetes in 2016, how did we actually do this? I've shown you two figures here, Professor Cook and Professor Yong. Professor Cook is a STEM researcher. He is a hardcore mathematical modeler, whereas Professor Joanne Yong is a non-STEM researcher. She's an economist and a behavioral scientist. And rather interestingly, we needed the partnership, not just of these two people, but of people like them across different disciplines to push for a single nationwide campaign, a nationwide policy against diabetes. Because while Professor Cook was able to show with his mathematical models what is the burden of diabetes to the country, to the workforce in Singapore in the year 2010 all the way to the year 2030, it was Professor Yong who was able to tabulate what is the cost to the society, the economic cost, not just of having to manage the medical problem, but also to look at the non-medical related cost to the society. For example, people who may be absent from work because they are unable to come to work due to diabetes or diabetes-related complications. People who are present at work, but because of diabetes and its complications are unable to focus their energy and attention to work. There's also people who have to be taken out of the labor force early or prematurely because of conditions related to diabetes. So all of this comes with a social cost. And understanding this social cost actually became the PhD project of Dr. Peng, who was a PhD student with Professor Yong. And Dr. Peng actually spent a lot of her time understanding and measuring what this cost would be from an economic perspective. And I talk about the different types of cost, both direct and indirect. And this is where we were able to pull information, not just from local databases, but also from international databases to really understand what is the social impact that a problem such as diabetes will have to the country. And equally, you would realize that we could extend the same methodology, the same research design in economics to look at many problems. It could be antimicrobial resistance. It could be understanding what is the total cost of COVID-19, or it could be also looking at if we promote health, physical activity amongst the elderly, what are the averted costs to the society in terms of life years gained, in terms of disease averted. So I mentioned that we were able to justify to the cabinet in Singapore, to the ministers and the civil servants in Singapore, how a problem like diabetes, by translating the disease burden to an economic burden, we were able to capture the attention of our policymakers and actually launch the war against diabetes. So this is one way that academic research that you and I do can actually influence policy and influence the way that society looks at a problem. The next example is really thinking about how we structure our healthcare system in the first place. Now, some of you who have been in Singapore for long enough will realize that, will remember perhaps that early days, Singapore's healthcare system actually underwent several transformations. Right now, we have what we call free clusters. But actually, before we had free clusters, Singapore had 6 healthcare clusters. And it was due to the research by Dr. Ong Xuan Yi, together with her PhD supervisor, Professor Helena. They conducted in-depth interviews and focus groups discussions with leadership of Singapore's health system. And this included ministers, ministers of states, permanent secretaries, CEOs of hospitals, medical directors of hospitals, including public health leaders, to really understand how health systems should be structured. So even though the outcome was a medical related issue, but fundamentally we were looking at how systems should be framed, and the skill set to design some of this are completely in the social sciences and in the non-STEM sector, because the research design was never through mathematical modeling, never through surveys, but actually through in-depth interviews. And the designs, the framework that is necessary to be crafted is actually a skill set that people picked up in non-STEM related research. And leading to this, I mentioned that we were in 6 clusters, and actually at one point it almost looked like it will fragment even more to 7 clusters or 8 clusters. Singapore subsequently reorganized our healthcare system to the 3 clusters that now we are much more familiar with: the SingHealth, the National Healthcare Group, and the National University Health Systems. So our PhD students were actually contributed to some of the discussions and thinking process in terms of how we redesign a national resource such as our healthcare system. Now, the third area, I can't talk about this without mentioning COVID this few years, because I believe many of you will be familiar with the challenges that Singapore faced around COVID-19. And in 2020, one of our biggest gaps in our COVID-19 defense was in the way that we look after our migrant workers in Singapore. And this is where I'm very pleased to share our professors, Professor Teo Yik Ying and Professor Jeremy Lim. Actually, Professor Yi looks at social ecological determinants of health. And what that means is really looking at how behavior, societal norms, and the environment actually shape a person's health-seeking behavior. And understanding the drivers of health-seeking behaviors, or rather the lack of consciousness towards health-seeking behavior, is actually a very important aspect in trying to manage a nationwide or indeed a global problem such as COVID-19. So our migrant workers, unfortunately, is still restricted to move about in society. But if you think back to March 2020 or April 2020, the migrant workers were permitted to move about during their rest time, during their off days in the weekends. And there's always this general perception that they are the drivers of infections in Singapore. But the work of our colleagues actually highlighted that right now, the migrant workers are much more afraid of our community, because as they move about the community, they are much more likely to be infected by a member in the community, and then they bring back that infection to infect their fellow dorm mates who are staying in the same rooms. That is a bigger worry for them. And there are a lot of issues linked to mental well-being of our migrant workers that Professor Teo Yik Ying and his PhD students have been focusing on. And similarly, I would like to also mention another PhD student of ours, Dr. Rainer Tan, who has also been focusing on a rather difficult topic, which is the impact of COVID-19 on commercial sex workers. So the reality is that commercial sex workers exist in Singapore, as well as sex workers that are not officially sanctioned. Singapore, we govern sex work, but there are approved or approved sex workers as well as illegal sex workers. And these are the people that comes under a lot of pressure when there is a problem, a nationwide problem or global problem like COVID-19. Because while there was the job security scheme, the job support scheme that offered salary support to many people, the entertainment workers were the ones that will not be eligible to receive some of this support. And Dr. Rainer Tan, again, it's using a social science construct to really understand what is the impact, and their qualitative design, qualitative research design, including in-depth interviews, including surveys, actually allowed us to identify what are the challenges, what are the key weaknesses that happen, that we observe amongst this vulnerable group in Singapore. And this information is actually presented to policymakers in Singapore such that they can tailor certain policies to minimize the risk to this group of people. And again, you can see the work that we do in public health directly has an impact to society. And that's something that we push for. And I thought it's also useful to talk about beyond Singapore, some of the non-STEM work that we do in outside Singapore as well, because the School of Public Health is active not just locally, but also regionally in a number of South Asia and Southeast Asian countries. So I will just share one example around tuberculosis case finding in Cambodia, because in Singapore, where TB, it's a mandatory reporting infection. So if you have TB, you go to any GP or polyclinics or doctor, the moment they know that you have TB, they will report it to the government. So there is an active database there. But the problem in other countries is that trying to find people with TB is quite difficult because there is no active reporting. So there is a need for NGOs and government to actively go out into the community to find out where these cases are. Because TB, it's just like TB is an infectious disease. If I'm able to identify the cases, I can reduce the spread to other vulnerable people. And that is why active case finding, just like in Singapore, we call it contact tracing for COVID-19. It is a form of active case finding strategy. Contact tracing is part and parcel of the reason why Singapore has done very well in minimizing the risk to the community up until we started our endemic COVID strategy, but that's a separate discussion. So contact tracing, active case finding is a very important strategy, but just as important, it's how do we determine which policy or which strategy works better? Because the government may adopt one approach, which is loosely called seed and recruit. I identify someone who has been infected, and then I expand from there to find out who are the people that this person typically interact with, their family members and so on. Or is it one-off? I go into the community once off and try and find people. So there are pros and cons to different approaches. The effectiveness, the economic benefits, the cost to the society, all of this actually comes under a research design that is much more qualitative, much more economic driven. So this is the work by Alvin, who still is a PhD student. He's finishing up his PhD as we speak, but he has been working on TB, active case finding strategies, and other related problems in Cambodia. And as part of his PhD, he actually is based in Cambodia itself for a few years. So in summary, I think public health research really straddles both what we would consider STEM and non-STEM, the social sciences, the economics, the behavioral sciences, the implementation sciences. I talk about economics, but equally the law, the ethics, the anthropology side of things are just as important in making sure our policies for public health, as well as our programs for public health, are actually effective. And at the end of the day, when we think about a lot of public health issues, there's always this concept about social responsibility, individual responsibility. How do we translate some of the knowledge that scientists, policymakers have to the lay public such that it will shape their behavior as well? All of this you would realize that is part and parcel of what a researcher in public health does. So I often like to say that public health is one of the schools that challenges the academic system a lot, because in public health, other than the typical outcomes of publications and grants that academics get benchmarked on, in public health, we value the impact to policies, to the community, just as much as we value our academic publications. So with that, I will stop here and very happy to take questions and end off with this statement about public health research. Thank you.